From PsychHub and Columbia University Department of Psychiatry and presented by HCA Healthcare. You ask, we answer.
Biggest difference between children, adolescents, and adults is that children and adolescents don't actually express their sadness or depression with low mood. They actually express it with more irritability than anything else. So like school refusal or having tantrums, that is actually the biggest difference in how to recognize it with children. And another telltale sign is weight loss, right? So I talked about appetite dysregulation, but one of the ways in which you can catch it is noticing that, is my child actually reaching their developmental milestones in terms of weight at the time that I would think was appropriate. If not, and they're underweight, then that might also be a way to recognize what's going on. This is a pretty serious thing because what we know is that depression typically begins around adolescence, right? Like between 13 and 16, 17 years old. But the younger someone is actually diagnosed with depression, this is associated with higher risks of recurrence in adulthood. It's associated with more depressive episodes in adulthood. And we know that for those adults that had childhood depression when they were younger, they also had higher rates of suicide than those without. It's extremely important to catch it early, to be able to provide treatment early, to kind of intervene when we can. To have depression doesn't mean that you are depressed, right? Like you are someone who's dealing with depression at a moment in time. And we do know that, again, medication and psychotherapy are extremely effective with being able to help. So just because you have depression doesn't necessarily mean it's something that you have to carry all of your life. And it's just part of you, just like you would have at some point in time kind of have high cholesterol or maybe high blood pressure at some point. You can do something about it.
Treatment and support can help. If you or someone you know is experiencing mental health symptoms, contact a health professional to learn more about treatment options. Thanks for watching. If you have questions or topics you'd like to see in future episodes, drop those in the comments below or head over to our community tab to join the discussion. You Ask, We Answer is here to answer your questions around mental health. Be sure to like, subscribe, and turn on notifications. You can also find an extended interview with this guest on the You Ask, We Answer podcast, available now wherever you get your podcasts.